Another procedure in body contour, the body contour group of surgeries that we see very commonly here at PSS is what we call the mommy makeover surgery. That's a group of procedures, usually a combination of tummy tuck or abdominoplasty combined with liposuction and sometimes breast augmentation or breast lift that correct the changes that occur with pregnancies, especially multiple pregnancies. It's kind of a combination between reconstructive surgery and aesthetic surgery because the changes that happen to the body are usually not something that can just be corrected with diet or exercise. So it involves a combination of those skills that we've developed through the individual surgeries of abdominoplasty, breast augmentation, breast lifts, etc., that we've talked about before, and combining them in a safe way to create a change that just can be life-changing for certain individuals because they've lost the ability to get back the figure or the physique that they always had in the past. So mommy makeover surgery is very, very common today. Another procedure on the male side that we tend to see a lot is what we call gynecomastia surgery. That's correction of deformities of the male chest. You know, men have breast tissue just like females do, and sometimes it becomes excessive. It may be primarily fatty tissue that causes an embarrassing development of what looks like a female breast on a male. If that's the case, it can be corrected with liposuction procedures like vasor liposuction or smart lipo, which is laser liposuction, creating a change in just a few minutes that's bothered somebody for their entire life. For some individuals, it may require more. It may actually require surgical excision of the enlarged breast tissue beneath the skin along with the liposuction procedures, etc. But in either case, it creates an immediate change that is a very disconcerting procedure for a lot of men in this country. So those are two of the individual body contouring procedures that we tend to see on a weekly basis that are very common at PSS.
Body contouring has become a very popular segment of what we do here at PSS. A lot of women and also some men are coming to us wanting to have a tummy tuck or a body lift or liposuction. And in general, I like to refrain from those terms because ultimately what you want is you want your torso sculpted. And those three are actually tools that we can use in conjunction with each other to get the shape that you're looking for. So instead of focusing on the individuals, it's much more important to focus on the issues that bother you. Come into your surgeon and say, listen, this bothers me, I don't like this, I don't like this, I don't like this. What are the things that we can do to make that look better and obviously make it realistic? So we do talk about a little bit of the details of what a tummy tuck is versus a body lift versus liposuction. In general, liposuction is just removing the fat, the upholstery which sits between your skin and the underlying body. That's all we do. We're not tightening up the underlying muscles. We're not changing the underlying contour. We're just reducing that upholstery in the area that is bothersome to you. The younger you are, the more elastic your skin is and the better retraction you're going to have and most likely the better result. The older you get, the looser the skin. You may get a nice contour when you're in clothing, but if you're naked, it could look a little rippled and it may look like the skin is hanging. When that happens, we tend to go towards a tummy tuck or a body lift. Body lift means that we go all the way around the torso in the level of the waistline, whereas the tummy tuck, you're really just going from hip to hip. The most important part with the tummy tuck is it gives us access to work with the underlying structure, the abdominal wall where your abdominal muscles and the fascia, which is that very tight white skin that sits above, which has usually been stretched out during pregnancy, can be tightened up at the same time. And that's actually the most uncomfortable part about a tummy tuck. But the beauty of a tummy tuck is that you contour the underlying surface that the skin and the fat sits on, which can most likely give you the best possible contour for what you're looking for. Now there's a couple pet peeves that we have here at PSS when it comes to our tummy tucks. The incision have to be so low that you cannot see. You need to wear something really low cut and you should not see that incision. Number two, the belly button needs to look like a belly button, and it needs to be far enough away from that incision, at least 10 centimeters. We see over and over again in restorative abdominoplasties where other surgeons have made that too close, and it's very difficult to repair. So if it's done right the first time, then you're set up for anything that needs to be revised in the future, but most likely, done correctly, you'll be a happy camper and you only do this once.